Music therapy and dementia. Why dementia? Worldwide, 36 million people are estimated to live with dementia, and this number is rapidly increasing. Also, the majority of residents in nursing homes have dementia. Randomized controlled trial. Individual music therapy for agitation in dementia. 48 to 82% of people in nursing home show symptoms of agitation. Dementia influences perception, attention, memory, and social engagement. Methods. The study was designed as a pragmatic two-arm crossover exploratory randomized control study. The primary outcomes, agitation and quality of life, were scored at baseline in week 7 and week 14. The researchers designed the study protocol in collaboration with a group of clinicians from Denmark and Norway. Demographic data were obtained from contact staff with information on health and symptoms. After each session, scored based on 5 activities: improvisation, dance, listening, singing, and other activities. Statistical analysis. To analyze effects of music therapy, two approaches was used. First, they conducted an overall descriptive analysis. Second, they analyzed change in each condition of music therapy or standard care. 42 participants were randomized in standard care or music therapy. The majority of the participants were female, with 81 years as the mean age. Outcomes. According to outcome measures between standard care and music therapy, these results attained. Pros and cons. In this randomized control trial, data gathered from different centers. On the other hand, none of the music therapists were registered and had little experience in working as music therapists. What can we learn? This study shows that music therapy significantly reduced average agitation disruptiveness scores. Music therapy is recommended as a valid treatment of agitation and as a possibility to reduce psychotropic medication. Qualitative approach. Staff views of music therapy group for people with intellectual disabilities and dementia, a pilot study. Introduction. Qualitative methods have become more commonplace in areas such as health services research and health technology assessment. Pilot study is useful to find the problems of the research and epistemology of the research. Alzheimer's disease is a progressive dementia. Group content. The group involved 5 adults with dementia and intellectual disabilities, 2 women, 3 men. Methods. Introduction. The aim is orientation to group. Hello song. The aim is welcoming each member to the group. Flow drum. The aim is encouraging the group to be together. Glockenspiel and metallophone. Encouraging relationship. Basket of small percussion instruments. Offers choice for individual playing. Conducting the group. Experience of leadership. Goodbye song to experience of togetherness. Results. The data were analyzed using thematic analysis. Analysis involved coding and recording data within the transcripts. Outcomes of the group. They can all enjoy it together. Some staff reported seeing no differences, others reported positive reactions. Pros and cons. The result shows music therapy has positive effects for this group. No reported detrimental effects of attendance. Some longer term benefits were raised by staff. However, it was difficult to determine whether these changes were caused by attendance at the group. Staff felt that they were not sufficiently informed about the purpose of the group. What can we learn? This program can repeat for the similar groups. In the qualitative interpretation of data is important. Meta-analysis. Musical intervention for patients with dementia. Introduction. Active music therapy is defined as a combination of more than one musical therapy techniques that include playing musical instruments, singing, song drawing, talking, or dancing. In receptive music therapy, no activity is required from participants. Methods. The studies for this meta-analysis were selected from the academic databases and some research engines, as you can see, and Cambridge journals. Group personal intervention. Patient was listening on one's own or in interaction with the therapist. Classical relaxation and pop native music. Native pop music defines the category in which the music is native for the patients, like folk songs. When this was not the case, this dimension was coded classical relaxation music. Outcome measures. The outcome measures considered were affective, behavioral, cognitive, and psychological problems of people with dementia. All the studies found could be divided into within participants or between participants designs. Group contrast studies involve the comparison of a treatment group with the control group, whereas pre-test, post-test contrast studies employ one group which is tested before and after treatment. This difference is designed make effect sizes not directly to test the significance of mean size effects. 95% confidence intervals. Homogeneity of the effect size distribution was also considered in terms of Q statistic. Effect sizes smaller than 0.2 were considered small, between 0.2 and 0.6 medium, and above 0.6 large. Results. Only the total test results were used. 6 studies showed medium but non-significant effects of musical intervention on affective problems. Despite that, there were only 4 studies on the effect of music on cognitive problems. They indicate large, homogeneous, and significant effects of music intervention. Likewise, the combined results of 4 studies examining effects upon psychological outcomes showed a large, homogeneous, and significant mean effect size. The overall samples were 477 and effect sizes was 1.04. We can see the results of effectiveness of different types of music intervention for listening, active music therapy, classical relaxation, and popular native. Pros and cons. Small sample sizes, not expensive, no side effect. The effects are widespread at all levels of the organism. What can we learn? Effects on spatial tasks, category fluency, and autobiographical memory. Also, the effect on psychological outcomes showed a homogeneous, high, and significant effect. References: